What's up, guys? Today I'm going to be showing you step by step how to take your blood sugar using a glucometer, and you're going to be learning the easy way to do this. Now, a lot of times, especially where you are, you may have never done this before. You may have experience doing this, but today I'm going to be giving you a step by step breakdown on exactly what you need and how to take your blood sugar. So before you begin and before you make your first prick here, a couple things you're going to need, okay? The first is a glucometer right here, a lancing device right here, lancing strips right here, glucose strips, and alcohol prep pad. Okay. Now, before you go out and buy each of these things individually, a lot of times these will come in packs. You can find them at your local Walgreens, your local CVS, Walmart. Now, with glucometers, there's a lot of different brands of glucometers and glucose meters. So at the end of the day, there are some better brands than others, but a glucose meter is going to be a glucose meter. So you got to find one that fits your budget, that maybe your doctor recommends, something along that line. As you can see over here, they look a lot. There's a lot of different looks to them. This one looks like a beeper. This is a little bit more slender, the mini. Then you have CVS brands and Walgreens brand. So as you can see, there's a lot of different types of glucose meters. I've accumulated a bunch over the years as I've done my own self-experimentation, but just finding one that works for you. Right now, today, we're going to be using the One Touch Ultra Mini right here. I like this one a lot. Slender, you can fit it in your pocket, nice and easy. So the first thing is first, when you're buying a meter, typically they come with a meter, lancing device, sometimes a few lancets, and sometimes an alcohol prep pad, okay? Typically they don't come with the glucose strips themselves. Usually you have to buy the glucose strips to match the glucometer. So one thing to note, when you're buying glucose strips, you don't want to buy two different brands. Like, you don't want to buy One Touch glucose strips for a Walgreens monitor. You want to buy One Touch glucose strips with the One Touch monitor, all right? So you have to make sure that the brands match up, because typically they don't fit, they won't fit back and forth here. So today we're going to be using, like I said, the One Touch Mini with the One Touch strips here. And I'm going to show you how exactly to do this step by step. So as you can see, I got my little setup here. I got my glucose meter, my lancing device, my lancing strips, my lancets, my glucose strips, and my alcohol prep pad. Okay, now, a couple steps before you begin. On your lancet device, you have to load this up, because this is where you have to actually draw blood, obviously. So you have to take your lancets right here and put them into your lancing device. Now, a lot of times, depending on the brand, these are going to work a little bit differently, but you'll get the idea today. So how this works is you take your lancet device and put it in the grooves of your, take your lancet and put it in the grooves of your lancing device, and you'll hear a click because it's spring loaded. So you'll hear that click, push it in, and it's activated, ready to go. Now, how you release this to actually get it into your skin, into your finger, is by pressing this blue button. Just like that. It's very, very simple. Now, when you do this, you push this in, and you then twist off the top of the lancet, okay? Which leaves the needle exposed, okay? Now, before you prick yourself, you have to put the cap on to make sure that you're going the proper depth into your skin. So you want to make sure that you don't hit that needle on your finger, because that will then contaminate the needle here. So what you're going to be doing is putting this on, placing it, securing it, ready to go, and now you're ready to take your blood glucose, okay? Now, one thing to note, at the bottom, typically on lancing devices, there is a dial with different numbers on it. This indicates the depth of which the needle will go, all right? So typically, if you have fair skin, very like paper thin skin, you want to use a less deep setting, okay? If you have very callousy skin and you find it hard to really get in and get that blood out, you're going to want to use a 7, which is the deeper setting. So today we're going to be using 5. So our lancet is ready to go. All right. Next up, what we want to do here is we got to clean the finger. Now, first things first, you always want to wash your hands before you take your blood sugar. I'm not going to show you how to wash your hands because I'm certain you're confident in doing that. If you're not, we have bigger problems here. But what you want to do is take your alcohol prep pad and wipe down your finger. Now, I always like to load up my glucose strip into the glucometer before you actually take it. That way you're ready to go when the blood is on your finger. So take this, you put the strip in. You want to make sure that the end where you take the blood is obviously on the outside. You don't want that to be on the inside here. So we're placing that in. Try not to touch the outside where you actually take the blood because this can contaminate the reading. So typically when you plug it in, it turns on and it shows a little dot that says, all right, take blood, time to take blood. So what we're going to be doing here, wiping down the finger. Now you can pick any finger. I'm going to use middle today. Now when you actually prick your finger here, you want to, check this out. This is where you can prick your finger. I drew a little smiley face on there. I like to prick in that area. You got the eyes and the smile. And this is typically where you have the most capillaries in your finger. And it's easiest for the blood to come out. So that's a good zone for pricking here. Now that we let the alcohol dry, we can actually prick this. So you want to, if your hands are cold, kind of warm it up, push the blood to the end of the fingertip. I'm going to go ahead, put the lancet onto the finger, push the button, and boom, we've got ourselves a sample here. Now you always want to wipe away the first sample of blood because there can be a little bit of glucose on the the end of the finger, which can kind of contaminate the reading a little bit. So you want to wipe that away and then take this reading here. So you put it up right to the blood, and the machine does its work here. So right now I'm in 85. This is my fasting blood glucose. So this is going to be your reading. All right. Now, a couple things. You obviously want to write this down so you know what it is. Your fasting blood sugar. You want to write this down. And then to dispose of the stuff properly, you want to, a couple notes here for the procedures. You have exposed blood here. Okay. So you want to dispose of it properly, and then you have a used lancet, which you don't want to just throw in the trash can. So what you can do is take that lancet out. You can take the top off of the lancet, and you can push it back in so it's not exposed. And then if you can put it into a sharps container, those red containers that you can dispose of properly. You can put that in there, or if you don't have one of those, you can put it in an empty water bottle because your trash man is not going to appreciate grabbing your trash and getting pricked by a little needle. So don't throw that right in the trash can. So guys, that is how you take your blood sugar step by step. I hope that was helpful. In the comments below or in the side, let me know what questions you have and if you do this differently for yourself. So with that said, guys, hope that was helpful, and we'll talk soon.